I've been working in hepatitis for about 5 years now, and when I came into the hepatitis sector, I had no idea how much hepatitis B and C were out there in our community in Philadelphia. And I compare it to HIV here because HIV has done such a good job making itself known as a public health priority. We all know that it is an urgent disease that we need to be developing solutions for, but there's so much hepatitis as well, and yet you rarely hear about it in the media or see it on the news. And what we're trying to do in Philadelphia with our coalition is to change this, to start raising more awareness, to get people to know that there's a lot of hepatitis out there in our city. Our estimates are over 20,000 people in Philadelphia living with hepatitis B and over 45,000 living with hepatitis C. When we take a closer look at, there we go. So when you look at some of the figures, and I'll say that since 2012, the health department has had the capacity to conduct surveillance on hepatitis B and C. Sherry talks about Philadelphia being a leader. We stood out to our federal partners as well. Philadelphia is one of only 7 jurisdictions nationally that has funding from CDC to do enhanced surveillance. So we can take a closer look at what hepatitis looks like in Philadelphia. And our surveillance team has done a great job crunching our numbers. And as you can see, unfortunately, when it comes to Hep C, the same disparities that we see a lot in our community around other health issues are the same around hepatitis C. A lot of our Black community is affected by hepatitis C more so than whites in Philadelphia. And you also see, similar to national trends, a lot of people who fall into the baby boomer age group between ages of 45 and 65 are disproportionately affected by hepatitis C. And again, in keeping with national trends, what we've seen over the last few years is that while the baby boomer age group has been continually the most affected, if you keep sliding through, you'll see, so in 2009, you start to see the numbers of youth go up as well, peaking in 2013. So people under 30 are becoming more infected with hepatitis C as well. If you've been paying attention to the news over the last few weeks and months, you've probably heard about the outbreak of HIV and hepatitis C in Indiana. That's a result of increasing drug use among young people. Well, we're seeing that in Philadelphia as well. We're starting to see more infections among that under 30 age group. So it's something that we really want to be aware of and try to be doing more. And the other concern with this age group is that women who have hepatitis C in this age group are then at risk of passing hepatitis C onto their children. So we're now seeing hepatitis C kill more people than HIV, which again is a statistic that I find really shocking and jarring and that you don't hear a lot about in the media. Because hepatitis C is a silent killer, it can live in your body for decades, those baby boomers who make up the majority of cases are starting to die of hepatitis C. There are drugs now that can cure hepatitis C. These drugs can cure hepatitis C with minimal side effects in less than 12 weeks. When some of the newer drugs, it's as little as 8 or even 6 weeks in some of the studies that are coming out. People do not have to be dying of this disease. And so that's why in 2012 we started HepCap, Hep C Allies of Philadelphia, because we think we need to stop people from dying, and we know that we have the tools to do it. If you've worked at all in the field of HIV or are aware of HIV, you'll know that services are being talked about as a continuum, and we're talking about hepatitis C in the same way. To access a cure, it often requires patients to go through a lot of appointments to get a confirmatory test, to get them to a specialist, and then to have tests run. And it also often requires a lot of hurdles to jump through when it comes to dealing with insurance, because as you may have seen in the media, while there is a cure for hepatitis C, it is very expensive. The initial cost was over $84,000 for a course of treatment, which is about $1,000 a pill. We are starting to see those prices come down, but insurance companies are still a little nervous about, 40,000 people in Philadelphia alone paying for all those people on an $84,000 course of treatment. It costs a lot of money. So unfortunately, when we look at the care cascade for hepatitis C, we still have a lot of work to do getting people not just linked to care and a cure, but even getting them tested. So again, this is where HepCap said, with over 300 community partners representing over 50 community groups, city agencies, industry partners, the local universities and medical centers, we're working together to try to figure out how we can bridge these gaps, how we can improve collaboration between our agencies, how we can educate our community better. But as you'll see in the next slide, it's really hard to do when resources are so limited. If you look at the orange and purple, those are the purple and blue. Those represent cases of hepatitis B and C in the United States. But when it comes to federal funding and national funding, you can barely even see hepatitis. HIV, you know, again, receives a lot of money, it's gotten a lot of media attention. But hepatitis B and C do not have a lot of resources. At the health department, we have 1 prevention coordinator and 5 surveillance staff who do data collection. And that's it on a health department level. Luckily, we have all of these community partners. We would not be able to do as much as we've been able to do without them. But we can always use more support, whether that's in the form of manpower or finances. And the fact that we've been able to do as much as we have with limited resources just tells me that we could do even more amazing things if we had some more funding behind us. Thank you.